Intracranial hypertension is a serious medical condition characterized by increased pressure within the skull. This pressure can affect the brain and other critical structures, leading to a range of symptoms that require prompt attention. Often people confuse intracranial hypertension with general headaches or other less severe issues which can delay diagnosis and treatment. Recognizing the symptoms early is essential to prevent complications such as vision loss or brain damage. In this video, we will explore the key symptoms of intracranial hypertension that you shouldn't ignore. From persistent headaches and vision disturbances to nausea and ringing in the ears, these signs signal that pressure inside the skull is elevated and potentially harmful. Understanding these symptoms can help you seek timely medical care and protect your neurological health. We will also discuss what causes intracranial hypertension, who is at risk, and how the condition affects brain function. Moreover, we'll guide you through the diagnostic process so you know what tests to expect and when to consult a healthcare professional. If you or someone you know experiences symptoms associated with increased intracranial pressure, this video will provide vital information to help navigate the condition effectively. Early awareness and proper management are the keys to reducing risks and improving outcomes. Stay with us as we break down the complex topic of intracranial hypertension into clear, understandable terms and actionable advice. 1. What is intracranial hypertension? Intracranial hypertension (IH) is a medical condition characterized by increased pressure inside the skull. This pressure builds up due to an imbalance between the production and absorption of cerebrospinal fluid, CSF, or from swelling of the brain tissue or blood vessels. The skull is a rigid enclosed space, so any increase in volume of these components leads to increased pressure, which can compress the brain and other vital structures. If left untreated, intracranial hypertension can cause serious damage, including vision loss, brain herniation, or even death. There are two main types of intracranial hypertension: primary, also known as idiopathic intracranial hypertension, and secondary. Primary IH occurs without an obvious cause, often affecting young overweight women, and is sometimes referred to as pseudotumor cerebri because its symptoms mimic those of a brain tumor despite no tumor being present. Secondary IH results from identifiable causes such as head injury, brain tumors, infections, or vascular problems. The hallmark feature of intracranial hypertension is increased intracranial pressure, which disrupts normal brain function. Since the brain and spinal cord are cushioned by cerebrospinal fluid, any disturbance in the flow or absorption of this fluid can cause pressure to rise. The elevated pressure can reduce blood flow to the brain, impair nerve function, and lead to swelling or damage. Intracranial hypertension symptoms are varied, but often include severe headaches that worsen with movement or lying down, visual disturbances such as blurred or double vision, ringing in the ears, nausea, vomiting, and sometimes cognitive changes or difficulty concentrating. The headaches in IH are typically persistent and may be accompanied by a feeling of pressure or fullness in the head. Diagnosing IH involves a combination of clinical evaluation imaging studies such as MRI or CT scans to rule out other causes, and lumbar puncture to measure cerebrospinal fluid pressure. Early diagnosis is critical because prolonged elevated pressure can lead to irreversible complications. Treatment strategies depend on the underlying cause. For idiopathic intracranial hypertension, weight loss medications that reduce CSF production and therapeutic lumbar punctures are common approaches. In cases where IH results from tumors or other secondary causes, addressing the primary condition is essential. In severe cases, surgical interventions may be necessary to relieve pressure. Understanding what intracranial hypertension is helps highlight the importance of recognizing its symptoms early and seeking medical care. While it may sound intimidating, many people with IH can manage their condition effectively with proper treatment and monitoring. 2. Common symptoms of intracranial hypertension. Intracranial hypertension, IH, presents a range of symptoms that vary in severity depending on how much the pressure inside the skull has increased. Recognizing these symptoms early is crucial because they can signal serious underlying issues that require immediate medical attention. The most common and often earliest symptom is a persistent headache. Unlike typical headaches, IH headaches are usually severe and do not respond well to standard painkillers. These headaches tend to worsen when lying down, bending over, or coughing, as these actions increase intracranial pressure. The pain is often described as a deep throbbing pressure and may affect the entire head or concentrate around the temples and behind the eyes. Vision problems are another hallmark symptom of intracranial hypertension. Patients often experience blurred or double vision, which occurs due to swelling of the optic nerve, a condition known as papilledema. This swelling results from increased pressure transmitted through the cerebrospinal fluid surrounding the brain and optic nerve. Some individuals may notice transient visual obscurations, brief episodes where vision dims or blacks out temporarily, usually lasting a few seconds. If left untreated, papilledema can lead to permanent vision loss. Tinnitus, or ringing in the ears, is commonly reported by individuals with IH. This ringing often coincides with the heartbeat known as pulsatile tinnitus and results from turbulent blood flow due to increased intracranial pressure. This symptom can be distracting and distressing, but is a key indicator of IH. Nausea and vomiting are frequent symptoms due to the pressure affecting brain regions that control these reflexes. These gastrointestinal symptoms may accompany headaches and are often worse in the morning. Some patients report dizziness or balance difficulties, which can occur when the increased pressure affects the brain areas responsible for coordination. Cognitive symptoms, such as difficulty concentrating, memory problems, or confusion, may also develop as IH progresses. Other, less common symptoms include neck stiffness, sensitivity to light, and hearing loss. Fatigue and general feelings of malaise are also frequently experienced but can be mistaken for other conditions. The wide range of symptoms makes intracranial hypertension a challenging condition to diagnose based on symptoms alone. However, when these symptoms appear together, especially persistent headaches and vision changes, they strongly suggest the need for prompt evaluation. If you or someone you know is experiencing any combination of these symptoms, particularly if they are worsening or persistent, it is vital to seek medical assessment. Early intervention can prevent complications and preserve neurological function. 3. Causes and risk factors. Intracranial hypertension. IH can arise from a variety of causes, some well understood and others less clear. Understanding these causes and the factors that increase your risk helps in early identification, prevention, and targeted treatment of the condition. The primary distinction in causes lies between idiopathic or primary intracranial hypertension and secondary intracranial hypertension. Idiopathic IH occurs without an identifiable cause and is often linked to specific risk factors rather than a direct medical condition. This form typically affects young, overweight women between the ages of 20 and 50. Obesity is the most significant risk factor here, as excess body weight can influence cerebrospinal fluid dynamics and intracranial pressure. Rapid weight gain or hormonal changes, such as those occurring during pregnancy or with the use of certain medications like oral contraceptives, may also contribute. Secondary intracranial hypertension results from underlying medical conditions or external factors that increase pressure inside the skull. Brain tumors, infections like meningitis or encephalitis. Brain hemorrhages or trauma can all lead to elevated intracranial pressure. Vascular conditions such as cerebral venous sinus thrombosis, where blood clots block veins, draining blood from the brain, are also common causes. Additionally, conditions that interfere with cerebrospinal fluid absorption or production, including hydrocephalus, can cause pressure to build up. Certain medications are known to increase the risk of IH. These include tetracycline antibiotics, high doses of vitamin A, or retinoids, corticosteroids, and some hormonal treatments. Long-term use or sudden withdrawal from steroids can disrupt fluid balance in the brain, leading to increased pressure. Other risk factors include chronic kidney disease, sleep apnea, and systemic lupus erythematosus. These conditions can affect fluid regulation or cause inflammation, contributing to intracranial hypertension. Genetic predisposition may also play a role, although research is ongoing in this area. Lifestyle factors, especially obesity, remain the most modifiable risk factor. Weight loss has been shown to significantly reduce symptoms and intracranial pressure in idiopathic IH. This makes early diagnosis and intervention crucial in managing the condition and preventing progression. Understanding your personal risk can help guide lifestyle choices and prompt timely medical evaluation if symptoms arise. If you fall into high-risk categories, regular checkups and monitoring become even more important. In summary, intracranial hypertension can be caused by a mix of idiopathic factors, medical conditions, medications, and lifestyle influences. Knowing these causes and risk factors aids in early detection, informed treatment, and better health outcomes. 4. How intracranial hypertension affects the brain. Intracranial hypertension, IH, significantly impacts brain function by increasing the pressure within the skull, which houses the brain and its protective cerebrospinal fluid, CSF. Since the skull is a rigid confined space, any rise in pressure can compress brain tissue, reduce blood flow, and interfere with nerve function, potentially leading to serious neurological complications. One of the primary effects of increased intracranial pressure is the compression of brain structures. This compression can disrupt normal communication between neurons, impairing functions such as memory concentration and coordination. Patients with IH often report cognitive difficulties, including trouble focusing and mental fatigue, which can hinder daily activities and overall quality of life. Elevated pressure also affects the optic nerves, which transmit visual information from the eyes to the brain. The increased CSF pressure around these nerves causes swelling known as papilledema. This swelling can distort vision, leading to blurred or double vision transient visual obscurations, and if untreated, permanent vision loss. Protecting vision is a critical concern in managing IH. The brain's blood flow is also compromised under increased pressure. Normally, the brain maintains a constant blood supply, but high intracranial pressure can constrict blood vessels, reducing oxygen and nutrient delivery. This reduction can cause headaches, dizziness, and in severe cases lead to ischemic injury or strokes. In extreme situations, elevated intracranial pressure can cause brain herniation, where brain tissue is pushed across structures within the skull. This life-threatening condition requires immediate intervention to prevent irreversible damage or death. Furthermore, the imbalance of CSF production and absorption in IH disrupts the brain's homeostasis. Excess CSF accumulation leads to swelling and contributes to the cyclical increase in pressure. This cycle exacerbates symptoms and complicates treatment. Understanding these effects highlights why timely diagnosis and management of intracranial hypertension are essential. Without proper control of pressure levels, the risk of lasting neurological damage increases significantly. Modern treatments aim to reduce intracranial pressure through medications, therapeutic procedures, or surgery when necessary to protect brain function and prevent complications. Early intervention is key to preserving neurological health and maintaining quality of life. In conclusion, intracranial hypertension affects the brain by compressing tissues, impairing nerve function, disrupting blood flow, and risking severe damage. Awareness of these impacts underscores the importance of recognizing symptoms and seeking prompt medical care. 5. Diagnostic methods and when to seek help. Diagnosing intracranial hypertension. IH involves a combination of clinical evaluation imaging studies and specialized tests to accurately assess pressure levels inside the skull and rule out other potential causes. Early and precise diagnosis is essential to initiate appropriate treatment and prevent serious complications. The diagnostic journey typically begins with a thorough medical history and physical examination. Doctors will ask about symptoms such as headaches, vision changes, nausea, and balance issues, as well as any underlying health conditions or risk factors. A neurological exam assesses reflexes, muscle strength coordination, and vision to detect any abnormalities caused by increased intracranial pressure. Imaging techniques like magnetic resonance, imaging MRI, or computed tomography CT scans play a crucial role. These scans help visualize the brain structure, rule out tumors, bleeding, or other abnormalities, and identify signs of increased pressure, such as swelling or compressed brain tissues. MRI is particularly effective in detecting subtle changes in the optic nerves and surrounding tissues. A lumbar puncture, also known as a spinal tap, is often performed to measure the cerebrospinal fluid (CSF) pressure directly. During this procedure, a small amount of CSF is withdrawn from the spinal canal and the opening pressure is measured. Elevated opening pressure is a hallmark of intracranial hypertension. Additionally, the fluid can be analyzed to exclude infections or inflammation that might mimic IH symptoms. Other specialized tests may include visual field assessments to detect any loss of peripheral vision due to optic nerve swelling. Ophthalmologic evaluations help monitor papilledema and assess the risk of vision loss. It is crucial to seek medical attention promptly if you experience symptoms suggestive of intracranial hypertension, such as persistent or worsening headaches, visual disturbances, nausea, or unexplained neurological symptoms. Early evaluation allows for timely diagnosis, which is key to preventing irreversible damage. Emergency care is necessary if symptoms worsen rapidly or are accompanied by sudden vision loss, severe headaches, confusion, or neurological deficits such as weakness or numbness. These signs indicate potentially life-threatening complications requiring immediate intervention. Regular follow-ups are important for individuals diagnosed with IH to monitor treatment effectiveness and adjust management plans accordingly. Patient awareness of symptom changes can facilitate early detection of any deterioration. In summary, diagnosing intracranial hypertension involves clinical assessment, imaging, lumbar puncture, and eye examinations. Knowing when to seek help based on symptom severity can save vision and protect brain health. 6. Treatment options and managing symptoms. Managing intracranial hypertension. IH effectively requires a comprehensive approach that aims to reduce the elevated pressure within the skull, alleviate symptoms, and prevent complications such as vision loss. Treatment options vary depending on the underlying cause, severity of symptoms, and individual patient factors. For idiopathic intracranial hypertension, the first line of treatment often involves lifestyle modifications. Weight loss is particularly beneficial, especially for overweight patients, as it has been shown to significantly reduce intracranial pressure and improve symptoms. Dietary changes and increased physical activity play important roles in this process. Additionally, avoiding medications that can exacerbate IH, such as certain antibiotics or vitamin A derivatives, is advised. Medications are a cornerstone of managing IH. Diuretics like acetazolamide are commonly prescribed to reduce cerebrospinal fluid production, thereby lowering intracranial pressure. These drugs help alleviate symptoms, such as headaches and visual disturbances. In some cases, other medications may be used to manage pain or associated symptoms, but it's essential to avoid drugs that increase pressure. Therapeutic lumbar punctures, where excess cerebrospinal fluid is drained, can provide temporary relief from pressure and symptoms. Although not a long-term solution, this procedure can be valuable for patients experiencing severe headaches or vision problems. When medical management is insufficient, surgical interventions may be necessary. Procedures such as optic nerve sheath fenestration aim to relieve pressure on the optic nerves to prevent vision loss. In more severe cases, cerebrospinal fluid shunting surgeries divert excess fluid from the brain to other parts of the body, reducing intracranial pressure. These surgeries carry risks and require careful patient selection and post-operative monitoring. Monitoring and managing symptoms is crucial. Regular eye exams help track changes in vision and optic nerve health. Patients should report new or worsening symptoms immediately, as prompt adjustments to treatment can prevent irreversible damage. Supportive care, including counseling and patient education, helps individuals cope with the chronic nature of IH. Understanding the condition, treatment options, and lifestyle adjustments empowers patients to actively participate in their care. In summary, treatment of intracranial hypertension involves a combination of lifestyle changes, medications, therapeutic procedures, and sometimes surgery. Early intervention and ongoing management are key to controlling pressure, preserving vision, and maintaining quality of life. Intracranial hypertension is a serious condition that demands timely recognition and management. From persistent headaches and vision changes to nausea and neurological symptoms, the signs your body gives should never be ignored. Understanding these symptoms and the importance of early diagnosis can make all the difference in preventing complications like vision loss or brain damage. At Active Healthcare, we are committed to providing clear, trustworthy information that empowers you to take control of your neurological health.